For many adults over the age of 50, the most alarming health concern is not just looking older, it is the quiet loss of energy, circulation, and mobility that slowly steals independence. Stiff joints in the morning, slower healing, reduced blood flow to the brain, and constant fatigue are often dismissed as normal aging, but research shows these changes are not purely inevitable. In fact, studies in geriatric medicine suggest that up to 60 to 70% of age-related decline in circulation and energy is influenced by daily habits rather than age itself. The good news is that there are simple, science-backed morning routines, like a traditional Japanese 3-minute activation method, that may help support circulation, flexibility, and cellular energy in the body when practiced consistently. I am Dr. Walker Official, and for over 25 years, I've focused on helping adults over 60 manage common aging-related health challenges, from circulation and joint issues to muscle loss and memory concerns. In this video, I'll show you what's really happening with early aging decline and the simple, practical steps that can truly make a difference. What makes this especially dangerous after 50 is that reduced blood flow and mitochondrial slowdown can quietly affect the heart, brain, and muscles at the same time. According to clinical studies, people over 60 can lose up to 1% of muscle strength per year if circulation and movement patterns are not actively maintained. Even more concerning, reduced morning circulation has been linked with higher risks of stiffness, dizziness, and slower cognitive response throughout the day. Over time, this creates a cycle where inactivity leads to even poorer circulation, and poorer circulation leads to more fatigue and weakness. Many seniors do not notice the early signs until mobility is already reduced. But what if the real issue is not age itself, but how the body is restarting every morning? Today, I will break down a simple ranked system of habits and foods, from least effective to most powerful, that influence how quickly your body reactivates after sleep. And most importantly, I will reveal a common mistake almost every senior makes in the morning that quietly accelerates stiffness, weakness, and energy loss without them realizing it. After we wake up in the morning, the human body is not immediately in its optimal working state. In fact, research in sleep physiology shows that during sleep, blood pressure naturally drops, circulation slows, and muscle activity decreases significantly to allow recovery. While this is healthy, the transition from rest to full daytime function becomes less efficient with age. After 50, the inner lining of blood vessels, known as the endothelium, becomes less responsive, making it harder for arteries to dilate quickly in the morning. This means oxygen delivery to the brain, heart, and muscles can be temporarily reduced right after waking, which is why many adults feel stiff, sluggish, or mentally foggy in the first hour of the day. Clinical observations from cardiovascular and geriatric studies suggest that morning is one of the highest risk periods for sudden cardiovascular events in older adults, partly due to these natural changes in blood pressure and circulation. Some reports indicate that heart attack risk is slightly higher in the first few hours after waking, especially in individuals with poor vascular flexibility or sedentary lifestyles. Additionally, age-related mitochondrial slowdown reduces how efficiently cells produce energy, which can make even simple movements feel heavier or slower than before. Researchers in age-related metabolism have also found that muscle oxygenation decreases with inactivity over time, and without regular stimulation, the body becomes less efficient at restarting itself each morning. This is why standard advice, like just exercise more, often fails for seniors. It does not address the immediate morning transition when the body is still in a low circulation state. Geriatric specialists emphasize that the first few minutes after waking are biologically critical because they set the tone for blood flow regulation, joint lubrication, and nervous system activation for the entire day. What many people do not realize is that this decline is not purely fixed or irreversible. The circulatory system still retains a degree of adaptability even in older age. With the right type of gentle activation, especially in the morning window, blood vessels can respond more efficiently, muscles can warm up faster, and the nervous system can shift out of sleep mode more smoothly. This is where targeted routines, like the traditional Japanese 3-minute activation method, become especially interesting from a medical and functional perspective. Many adults over 50 unknowingly make small morning mistakes that seem harmless, but actually place extra stress on already aging systems. One of the most common is jumping out of bed too quickly without giving the circulation system time to adjust. When the body moves suddenly from a horizontal sleep position to standing, blood temporarily shifts downward due to gravity. In younger people, blood vessels compensate quickly, but after 50, reduced vascular elasticity can delay this response, leading to dizziness, stiffness, or that heavy body feeling. Over time, repeated strain like this can worsen morning fatigue and slow circulation recovery. Another widespread misconception is relying only on coffee or tea to wake up the body. While caffeine stimulates the nervous system, it does not improve blood flow at the muscular or cellular level. In fact, if the body is dehydrated after sleep, caffeine can sometimes make the morning transition feel even harsher by narrowing blood vessels slightly. This means energy feels artificial and short-lived rather than truly restored from within. A third mistake is complete morning inactivity, sitting for long periods right after waking, often combined with phone use or TV. This keeps the muscles in a low oxygen state and delays the natural rise in circulation that the body needs to fully activate. Clinical observations show that prolonged inactivity after waking can extend stiffness in joints and reduce metabolic efficiency for hours. The key misunderstanding behind all of these habits is the belief that aging-related morning decline is unavoidable. In reality, many of these symptoms are driven by reduced stimulation of circulation, not permanent damage. When blood flow, gentle movement, and nervous system activation are introduced early, even in small, controlled ways, the body can respond more efficiently than most people expect. This is why researchers in aging physiology increasingly emphasize activation-based routines rather than symptom-based treatments. Instead of trying to fight fatigue after it appears, the focus shifts toward preventing it at the moment the body wakes up. Early studies suggest that even brief daily activation practices can help improve vascular response and reduce morning stiffness over time, especially when done consistently. Now let's move into the practical part, what actually helps the body wake up more efficiently and support circulation, mobility, and energy after 50. These are ranked from least effective, number 10, to most effective, number 1, based on how strongly they influence morning biological activation. 10. Cold room exposure after waking. A slightly cool environment can stimulate alertness by activating the nervous system and increasing sympathetic response. It may improve wake-up alertness by around 5 to 10%, but the effect is mild and does not directly improve circulation or joint stiffness. Alone, it is not enough to reverse morning sluggishness. Number 9. Warm lemon water. This supports mild hydration after sleep, which can improve blood viscosity and energy flow slightly. It may enhance morning hydration efficiency by 10–15%, but it does not directly activate muscles or vascular flexibility. It is supportive, not corrective. Number 8. Light stretching in bed. Gentle stretching helps reduce stiffness and improves joint fluid movement. Studies suggest up to 15 to 20% improvement in perceived mobility, but without coordinated breathing or circulation work, the effect fades quickly. Number 7. Short morning walk indoors or outdoors. Walking increases heart rate and blood flow, improving oxygen delivery. It can enhance circulation efficiency by 20 to 25%, but may feel difficult for those already stiff in the morning and does not specifically target vascular elasticity. Number 6. Herbal anti-inflammatory drinks like ginger tea. Ginger compounds may support mild circulation and reduce morning stiffness. Some studies show up to 20% reduction in inflammation markers, but effects are gradual and not immediate. Number 5. Deep breathing exercises. Controlled breathing improves oxygen intake and nervous system balance. This can improve oxygen saturation efficiency by 25 to 30%, but without physical movement, circulation in the lower body remains limited. Number 4. Magnesium-rich foods, like nuts or bananas. Magnesium supports muscle relaxation and nerve function. Regular intake may improve muscle recovery efficiency by around 30%, but it is not fast-acting in the morning window. Number 3. Hydration with electrolytes. Adding natural electrolytes helps restore fluid balance after sleep and supports blood pressure stability. This can improve circulation response by 30–40%, especially in older adults, but still lacks direct muscle activation. Number 2. Gentle full-body joint mobility routine. Slow rotational movements of the neck, shoulders, hips, and ankles help reawaken synovial fluid and improve stiffness significantly. Studies in geriatric movement therapy show up to 40–50% improvement in morning mobility when done consistently. Number 1. Coordinated breath movement activation, similar to the Japanese 3-minute routine. This combines controlled breathing with rhythmic, full-body micro-movements that activate circulation, oxygen delivery, and nervous system wake-up simultaneously. Clinical movement research suggests this type of combined activation can improve morning functional energy and circulation response by up to 60% compared to passive waking. Its only limitation is that it must be done consistently to maintain benefits, but its effect is fast and noticeable even within days. Yes, show more, show less. Now we focus on the most powerful and practical part of this system, the top 3 morning activation strategies that actually make a noticeable difference in circulation, stiffness, and energy after 50. The third most effective approach is electrolyte-based hydration immediately after waking. During sleep, the body naturally loses water through breathing and skin evaporation, which slightly thickens the blood and slows circulation in the morning. Rehydrating with a glass of room-temperature water plus a small pinch of natural electrolytes helps restore fluid balance and supports smoother blood flow. The ideal timing is within 5 to 10 minutes of waking. This simple step can improve morning circulation stability by roughly 30–40% in older adults. A harmless side effect can be mild stomach sensitivity if taken too quickly on an empty stomach, so sipping slowly is better. A medical caution is important for those with kidney disease or sodium-restricted diets who should avoid adding extra salt without guidance. The second most effective method is gentle joint mobility exercises. This includes slow rotations of the neck, shoulders, wrists, hips, knees, and ankles performed in a controlled and pain-free range. The goal is not fitness, it is lubrication and activation of the joints. After sleep, synovial fluid becomes thicker, which contributes to morning stiffness. Studies in geriatric physical therapy show that consistent joint mobility routines can reduce stiffness and improve functional movement by up to 40–50%. The key is slow, deliberate movement, not force. Done correctly, it helps the body transition from rest mode to movement mode safely. The most powerful approach is coordinated breath and movement activation, similar to the traditional Japanese 3-minute morning routine. This method works because it activates 3 systems at once: the respiratory system, the circulatory system, and the nervous system. By combining deep, controlled breathing with synchronized gentle movements of the arms, torso, and legs, oxygen delivery improves while blood vessels gradually expand. This creates a full-body wake-up signal that is stronger than any single habit alone. Research in movement science suggests this type of integrated activation can improve morning energy perception and circulation efficiency by up to 60% compared to passive routines. What makes this number 1 method superior is not intensity, but coordination. Instead of forcing the body awake, it gently guides all systems to restart together. This reduces morning stiffness, improves mental clarity, and helps stabilize energy for the rest of the day. A realistic limitation is that skipping days reduces its effect over time, so consistency matters more than duration. When these three strategies are combined in sequence, hydration, mobility, and breath movement activation, the body transitions much more smoothly from sleep to full daytime function than with isolated habits alone. Finally, it's important to understand what not to do, because most morning decline after 50 is not caused by a single issue. It is built from repeated small mistakes over time. One critical mistake is rushing the body immediately after waking, especially standing up too fast. This places sudden pressure on a circulatory system that is still in a low-flow state and can worsen dizziness and stiffness. Another mistake is depending only on stimulants like coffee to create energy. This masks fatigue temporarily, but does not restore circulation or muscle activation. A third mistake is staying completely still for too long after waking, which keeps joints locked and delays natural fluid movement in the body. A fourth mistake is ignoring morning hydration, which quietly thickens blood flow and reduces energy efficiency. The key reframe is this: what feels like aging is often a shortage of morning biological activation, not permanent decline. The body is still capable of responding. It just needs the right signals at the right time. Circulation, mobility, and energy are not fixed losses. They are systems that can be supported and improved with consistent daily input. For the next 30 days, the focus is simple and realistic. Each morning, hydrate properly, move your joints gently, and perform a short coordinated breathing and movement routine before sitting for long periods. The goal is not intensity, it is consistency. Over time, this supports better independence, safer movement, and improved daily comfort. If followed regularly, many adults notice mornings feel less stiff, more stable, and more controlled, helping the body feel more responsive throughout the day. SEO Master Prompt: Health Act as a senior-level YouTube SEO strategist specializing in health, nutrition, aging, and preventive medicine for audiences aged 50 plus in the USA. You are given above: video title, full video script. Your task is to generate a complete, high-performing SEO metadata package optimized for high CTR, long watch time, YouTube and Google search ranking, senior audience trust, full YouTube health policy compliance. Objective: create metadata that is clear, factual, and engaging, emotionally resonant for seniors, fear plus hope plus reassurance, medically responsible, no exaggerated cure claims, optimized for senior health search intent. Titles: generate three high CTR YouTube titles using this winning formula. Include age reference: over 60, after 55, seniors over 70. Clearly state the primary benefit or problem solved. Use specificity, numbers, timeframes, only, this. Create curiosity without clickbait. Optional soft authority phrase, for example, senior health tips, healthy aging guide, wellness for 60 plus, expert health tips, trusted health advice. It can be changed, or decide yourself. Titles must be under 70 characters, visible at mobile phones, be factual and compliant, avoid exaggerated medical claims. Be description, SEO optimized. Write a structured description that includes 1. Empathetic opening. Speak directly to seniors' daily struggles. Use you language. Acknowledge fear, discomfort, or loss of confidence. 2. Clear learning promise. What viewers will learn. Steps, foods, habits, or solutions covered. Emphasize simplicity and practicality. 3. Science-backed explanation. Mention biological mechanisms in simple terms. Reference studies or medical research generally. Avoid complex jargon. 4. Positive outcome visualization. Improved mobility. Reduced pain or swelling. Better balance, independence, and quality of life. 5. Channel positioning and CTA. Reinforce channel. Focus on senior health. Encourage subscribe, like, and comment naturally. 6. Medical Disclaimer: O educational purposes only. O consult healthcare provider. O do not stop prescribed medications. 7. SEO keyword saturation. O naturally include relevant senior health keywords. O avoid keyword stuffing. End the description with exactly 5 hashtags. All lowercase, no spaces or special characters. Mix of broad plus niche, directly related to the video topic. Special instruction for description. Output description should be completed only in 3 paragraphs through summarizing all instructions mentioned in description section B. C tags, generate 10 highly relevant YouTube tags. Mix of broad senior health niche for max searchability, plus specific condition, all lowercase, no spaces, no special characters, comma separated. Final output format must follow exactly. Titles: Title 1, Title 2, Title 3, Description, full description paragraph 1, full description paragraph 2, full description paragraph 3, hashtag, 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 hashtag 4, hashtag 5. Tags: tag, 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 tags, tag, 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 tags, show more, show less.